My name's Dave Higgins. I'm an internist, a respirologist by trade. You can probably guess from my accent I wasn't born in Canada. I came here in 1985 for 2 years, so I'm still here, and that's largely Canada's fault. I found it to be a wonderful country with wonderful opportunities for me and my family, so very glad to be here and today be a Canadian as opposed to being just Irish. And this is a very exciting time, but it's also a very frustrating and challenging time as well. You'll see frequently headlines in newspapers about frustrations about funding, capacity issues, wait lists, etc. And how come I ended up going from where I was as a physician and internist, a specialist, to where I am today, which is president of a fairly big hospital? But I do think this is a very exciting time, but it's also a really challenging time, and I do agree. This is not the time for incrementalism. It's not the time for sort of moving forward at a snail's pace. We do require a sort of a revolution. I don't mean taking to the streets with barricades, but I do mean a radical rethinking of how we think of ourselves as professionals, how we do and align our work as professionals, how we use new technology in radically different ways, and not ways that someone at my age it tries to invent, but someone with new thinking like you can. And I really admire this initiative. We're bringing together people from across faculties with outrageous ideas, but it's the outrageous ideas that make the big change. And the status quo, i.e. me, goes, that's too difficult, too complicated, can't be done. But it always falls to, I think, the new generation. You are the future, not me. And I think we're looking forward very much to competitions like this to make a change. We exist in a very siloed system. I work in a hospital, but the transitions patients make around our hospital and when they leave our hospital, when they enter our hospital, are times fraught with great anxiety and concern. The complexities of their lives and where they live and how they live are more important than what we treat them with in medication and medications and treatments, and those things have to be combined. And if you don't do that, we will fail our citizens. And I think the good news is we're recognizing that, and the good news is, I think, especially in a city like Hamilton, which is exciting, it's big enough. We've got a great university, we've got 2 very good hospitals, we've got a very good municipal staff and bureaucracy, and we've got a lot of great organizations within our city, I think, begin to think differently. But what's going to be the revolutionary step we must take? What's going to be that key new technology? What's going to be that innovation that we can take together? And it won't happen just because I say so, or McMaster University says so, or the City of Hamilton says so. It's because we decide to take on a new challenge. It'll feel incremental at first, but I think the snowball will begin to build. So I'm looking forward very much to what you create today, and I'm very glad to answer your questions and try, if I can, to keep up with you as the evening goes on.